This is a muscle taping technique applied to the hamstring grip, used to increase straight leg raise, to be referred to as SLR, and to assist forward flexion of the lumbar spine. First, note the patient's restriction of straight leg elevation during the SLR test, which reveals a tightness around the posterior thigh. This technique requires both an I strip and a Y strip. The base point of the I strip is located by firstly measuring to 2 finger breadths below the ischial tuberosity, and from that point measuring 2 centimeters laterally. The end point extends distally to the head of the fibula. The base point of the Y strip is located by measuring 2 finger breadths below the ischial tuberosity, and from that point measuring 2 centimeters medially. The tape then splits into a Y and extends distally to the medial tibial condyle. The end of each Y tail converges at a corresponding level with the end point of the I strip. Palpate the ischial tuberosity and mark 2 finger breadths below this. The base of the Y strip is placed 2 centimeters medially from this marked point. The base point of the I strip is placed 2 centimeters laterally from this marked point. The end point of the I strip is marked over the head of the fibula. The end points of the Y strip are marked at a corresponding level on the medial tibial condyle. With the patient standing in neutral, measure from the lateral base point to the head of the fibula. Cut and prepare an I strip. Measure from the medial base point to the tibial end point. Cut and prepare a Y strip. First, apply the I strip. Lay down 3 to 4 centimeters of tape as an anchor at the base. Instruct the patient to internally rotate the hip joint. Flex forward at the hip, maintaining full knee extension. Lay the I strip down along the outermost edge of the biceps femoris, ending at the head of the fibula with absolutely no tension. Return the patient to neutral. Next, apply the Y strip. Lay down 3 to 4 centimeters of tape as an anchor at the base. Instruct the patient to externally rotate the hip joint, flex forward at the hip while maintaining full knee extension. Lay the lateral tail along the outermost edge of the semimembranosus with absolutely no tension. Lay the medial tail along the outermost edge of the semitendinosus. The end of each Y tail converges at the tibial end point. Return the patient to neutral. Convolutions may be visible, but this is not a crucial indicator. Upon retesting the SLR, an immediate increase in hip flexion should be experienced. The therapist should report, and patient experience, a freer and lighter movement of the leg. If the patient does not experience a relief of symptoms, check the tape has been correctly applied or reconsider the choice of technique. If the symptoms experienced by the patient are isolated to either the biceps femoris or the inner muscles of the semimembranosus and semitendinosus, then either an I strip or a Y strip taping technique may be used rather than the combination of both.